Over the last 24 hours, we identified 442 new cases of COVID-19 and completed about 7,700 tests. Our positivity rate was about 6%. There are currently active alerts or outbreaks in 242 schools. Of these, 2 schools had 10 or more COVID cases who attended in the last 14 days while infectious. There are currently 836 people being treated for COVID-19 in hospital, including 183 in the ICU. Sadly, over the last 24 hours, 12 new deaths have been reported to Alberta Health. My thoughts are with the family and friends of these individuals. Their deaths are a painful reminder of the serious outcomes this virus can cause for people of many different ages, backgrounds, and health conditions. We are incredibly fortunate to have an effective and widely available tool to prevent the vast majority of these serious outcomes. The benefit of vaccines is clear in the numbers that we post online every day. For example, in the last 3 months, people over 80 years old who weren't vaccinated were 12 times more likely to die from COVID than those who were fully vaccinated. The protection further improves when we look at younger groups. For example, unvaccinated 70 to 79-year-olds were 52 times more likely to die from COVID in the last 3 months than those who were fully vaccinated. It's clear that we will not be able to eliminate COVID-19 either in Alberta or around the world, so we will need to learn to live with COVID-19. Anyone who is not fully vaccinated is almost certain to be exposed to COVID-19 at some point in the future if they haven't already been. And so it's another reason why for those who haven't been exposed yet, now is the perfect time to get the protection that vaccine offers. How that will look in terms of the timing of infections or how quickly those infections are grouped together will really depend, again, on how we work together as a province. It's why we continue to have public health measures in place, because our acute care system is continuing to be under significant strain, even as our numbers come down. We're sitting at about the same number of COVID patients in ICU right now as we had at the absolute peak of our 3rd wave. So even though it's encouraging to see numbers decline, again, that's why we're really needing to focus on protecting each other, both through vaccine and measures, and what a 5th wave might look like or how COVID will unfold in the future. Again, depends on multiple factors, including how many of us take the advantage of vaccine protection, including whether or not there are different genetic variants that emerge of COVID and how that interacts with the vaccine. So as we have always done, we will remain vigilant and watch the evidence and respond accordingly wherever there are needs to adjust our approach.